So I'm here to present a paper on basically on medical student specialties, right? So what motivates them in basically pursuing the specialty they want to go into. So just get started. So when I was a medical student, I found it very difficult to decide where I wanted to study. And I spoke to other medical students and they kind of felt the same way. So I did some research and I found this paper that looks at motivational factors that medical students use in picking their residency specialty. So get started. So this is a study done at the University of Connecticut School of Medicine from 2017 to about 2020. And they looked at motivational factors that medical students use in picking their residency specialty. Um, and understanding these factors is important because it can help impact the supply, physician supply, as well as influence their career path. One example that the paper talked about was how an increased supply of primary care physicians can lower cardiovascular disease and lower mortality in the prospective population. And so what's the significance of this? Um, one important thing is to understanding these factors can help better benefit medical students by helping to tailor medical school education to what's best for them. It also can help to understand and help them pick the right specialty for them as well. It can also help to reduce regret that graduate institutions have in picking the career choices. So the real big question is, what motivates medical students in being a residency specialist? All right, so as I stated before, this is a longitudinal study done from 2017 to about 2020. The annual questionnaire was administered to medical students, looking at what factors motivate them to be a residency specialty. And the sample size is roughly about 100 students or so. So here, this is the survey that they sent out. And you can see look at the questions, what residency you're most likely to pursue following medical school. And there's a list of specialties. It's a pretty extensive table. So we'll go over them in the next slide. And then what career paths you're most likely to pursue following residency. And then this is the most important question, which is rank the following six factors in terms of your importance to you in deciding your specialty slash career choice. So one is the least important, is the most important. So, using things like family education, interest in the field itself, that's very important. Just keep that in mind. Okay? And then, things like prestige, lifestyle, also very important. Keep that in mind as well. Financial incentives, match confidence. And then they ask other questions like what degree program are you in, year, age, marital status, if you have children. So again, this was an in-person questionnaire given to medical students at the beginning of lecture for years 1 and 2, and then prior to orientation for year 3. And then year 4 was sent out via email due to COVID-19. And this was a completely anonymous survey with no identifying information collected. So the specialties were characterized into primary care and surgery. So primary care included internal medicine, family medicine, pediatrics, okay, and then surgery included things like general surgery, orthopedic surgery, neurosurgery, vascular surgery, and then OBGYN was kind of considered its own separate category, because it's kind of a hybrid between surgery and clinic, so it was kind of considered separate. So this is just part of the table that they have. Um, this is the whole table. And I know it's like super overwhelming when you first look at it, but we're going to go over individual aspects of this in the next slide. So I tried drawing with the mouse and I was super clumsy at it. it didn't work, so I just threw everything in advance to kind of make things more clear. So the top choices in year one were internal medicine, general surgery, pediatrics, and OBGYN. Right? And then the least popular specialties with absolutely no interest at all were child neurology, pathology, and CMR. So everything is listed in alphabetical order. All right, so we have, this is year one. All right, so we have general surgery, about 11%, internal medicine, 14%, OBGYN, about 8%, and then pediatrics, also about 8%. And then the black here, this is the specialties with no interest. So it's neurology, 0%, pathology, 0%, and then PMR, that's also about 0% as well. So those are the specialties for year one. Alright, so for year four, the top specialties were internal medicine, emergency medicine, family medicine, pediatrics, OBGYN, and radiology. Now this is interesting because general surgery was the second choice in year one, but completely disappeared off the first six choices by year four. So that's really interesting. Alright, so here we go. Now we have the red is the top choices for year four. So emergency medicine, about 12% here. Family medicine, about 10%. Internal medicine, also about 15%. And then OBGYN is about 90%. And then radiology is also 100%. Next one. Okay. Now the specialties with the greatest change from year one to year four were orthopedic surgery, family medicine, radiology, general surgery, and anesthesiology. And well, these gold here, I guess you could say yellow, anesthesiology, 0% in year one, and that goes up to about 6% for year four. It's kind of interesting. And family medicine, 2% in year one, and look at that, it goes up to 10% year four. That's an 8% increase from years one to year four. That's really interesting. And then we have general surgery, about 11% in year one, and then drops to 4% by year four. So that's a 7% drop from year one to year four. That's pretty interesting as well. And then orthopedic surgery, about 14% in year one, and again, it drops to 4% by year four. So again, that's a 10% drop for surgery, for orthopedic surgery. And then here we have radiology, about 1%, and that increases to 9% by year four. That's very interesting. So those express the specialties with the greatest change. Alright, so this is the table that they included. The main thing I wanted to draw your attention to are the sample sizes. So if you look here, right, about 76 students responded in year one, and then 65 responded in year four. Now in year two, it's only 54 students, and in year three, it's 31 students. You know, so I mean, the sample sizes for years 2 and 3 were so small that the authors of the study couldn't even assess such students. And then the next thing I want to draw your attention to is that none of these people had children. I imagine families would be much more higher on the priority list if people had children. So that's just kind of interesting to me. Yeah. So there was no real significant motivational factor for year one, and that's because rankings play similar across the factors for year one. Now, however, interest in the field itself, right? So this would be like the day-to-day duties, target population, underlying science, and lifestyle. Those significantly increase in becoming the most important motivational factors by year four. And then prestige, family, financial incentives, match confidence, those decrease by year 4, and then family and location didn't really change. So with this graph here, they've included all specialties. So this is primary care and surgery together. Okay. We'll have a graph where they later on they'll separate family medicine, so primary care and surgery. So here we go. We have the y-axis is the factor input. So 1 is the least important, 6 is the most important. And then the x-axis are the factors, they're family and location, right? And then the little wheel circled here is a 0, 1. Little solid square is year 4, right? So that doesn't really change. Now look at this field interest, number 1 most important factor by year 4. So that's pretty interesting. And then prestige, down by year 4. Lifestyle, look at that, second most important factor by year 4. So that's pretty interesting as well. Now financial incentives are pretty well the same. Match confidence does go down by year 4. I would say that's simply because by the time people get to their 4th year, they have a pretty good idea of what they're going to match into. That's probably why it went down. So now the main thing that I want to point here is that field interest increased for primary care. And that was the number 1 most important factor for primary care. Prestige and financial incentives decreased for primary care. Now for surgery, interest in the field itself also increased. And also prestige and financial incentives were kind of more influential for surgery. So here we go. So this time what they've done is that they separated this out into this top graph is primary care. Okay. And then now we're looking at again factor the y-axis is the factor input. So 1 is the least important and 6 is the most important. And the x-axis are the factors themselves. So we have family and location here. This is year 1, so it's right here, and then it kind of rotates into years 1 through 4. Now again, field interest, number 1 most important factor by year 4. Okay. Financial prestige down, okay. And then lifestyle, again, the second most important factor by year 4. That's really interesting. And then financial incentive down, match confidence. Okay, there we go. So match confidence stayed relatively the same. Okay, that's fine. So now let's look at surgery. Okay. So family and location, that kind of stays the same from years 1 to 4. It kind of goes down. Okay. But again, field interest, look at this. Number 1 most important factor by year 4 for surgery. And then prestige, that does go down by year 4, but it's still ranked, as you can see here, it's like the least important year in primary care. And then it's kind of ranked higher than it was in primary. So, okay, that's kind of interesting. And then lifestyle, that doesn't really change much. And then financial incentives, that goes down by year 4. And then match confidence, that also goes down by year 4. And again, I think this simply by the people get to their 4th year, they have a pretty good idea of what they want to make into. So that kind of makes sense. Alright, so for year 1, about 25% of students were interested in primary care. But this increased to 34% by year 4. I mean, that's almost a 1.4 increase in interest. So that's very interesting. Now, in year 1, 38% of students were interested in surgery, right? And that decreased to 15% by year 4. That's less than half of what it was in year 1. So that's really interesting. So here's some graphs that they have. Right, this is for primary care. And here we have the y-axis, which is the percentage of students. Okay, so this is roughly about 25% interested in year 1. And look at that, it goes up to 34% by year 4. And it looks like the usual bars here look like maybe some family medicine went up. Primary care and pediatrics, those bars look the same. So here we go, we have surgery here. Now, 38% are interested in surgery in year 1, and look at that, it drops to 15% by year 4. And that's across all surgical specialties, not just one individual one. So that's really interesting. All right, so there's an increased interest in primary care and a decreased interest in surgery with the progression of medical school education. And so that's an interesting trend. Now the specialties with the greatest absolute change, and if you saw that in the previous earlier, were surgery that went down, family medicine that went up about 8%, I believe, and then radiology that went up, and then general surgery that went down about 7%, and then anesthesiology that went up about 6%. And fewer medical students are pursuing surgery, and this study kind of supports. All right, so interest in the field itself and lifestyle became the most important motivational factors by year 4. And I think we saw that with the graph that I showed earlier. And the hours of surgery and the training commitments are a common reason why many medical students are not going into surgery. And this study kind of supports that theory. Now what's interesting is that field interest, right? So again, that's day-to-day hours, the target population, the underlying science, which ranks the highest for both primary care and surgery. And this really makes a lot of sense because you're going to pursue something that you're interested in. That's what you're going to go into. You're not going to go into something that you have absolutely no interest in at all. So that really makes a lot of sense. So in year 1, there was really no difference in motivational factors because rankings were very similar across the factors. And this is most likely due to the fact that medical students were just starting their education and they really had no exposure to any sort of medical. Now what's interesting is that as medical students completed their education, as well as the clinical rotations, interest in the field itself and lifestyle became the most important factors. Okay? And again, this makes sense because once you're exposed to a specialty, you see what the hours are like, the training, the target population, you kind of make a much more informed decision whether that's the right specialty for you. So it makes a lot of sense. So some limitations of this study are again, I think I mentioned this before, but here it is simple side. If we look here, it's like, year 1 it's about 76 students, and year 4 55 students. But again, 54 students for year 2 and only 31 students for year 3. So the sample sizes were so limited for year 2 and 3 that the authors of the study couldn't even assess those stages at all. And also there's no interest in child neurology, pathology, or PMR, which are specialties that many medical students are interested in. I mean, I'm interested in pathology, and no one interested in it there. So the final thing I want to mention is the surveys were anonymous. So it's very difficult to track the same medical student throughout the whole process. I mean, you don't really know if the people responding in year 4 are the same people responding in year 3. So I imagine that doing this study on a larger cohort of students would be much more beneficial and probably yield even better results. So let's look at this system. So some of my thoughts, I think I also mentioned this before, which is none of the students had children. I imagine families would be very higher. Students had children. And also the two major trends of an increase in primary care and a decreased interest in surgery are things that I've kind of noticed just from talking to medical students as they progress with their education. One comment I'll say is that the hours of surgery are very low, and these two terms a lot of people off, right? And that's just how it is. All right, so also the rotations that are available at a site, those make a huge difference. For example, PMR and pathology, those are elective rotations, and they can only be done if the student expresses interest and if they are available at that site. So, for example, there are a few people that want to do pathology, but they couldn't get a rotation. Then they're taking a completely different specialty. So, maybe if they had been able to do a pathology rotation, maybe they would have gone into it. And I mean, there's no real way to know, I suppose, but you can just kind of feeling this would think. There's a study, kind of a reference of a study that I'm talking about so far. So that's pretty much it for me.